First question has to be, I'm afraid, about the leading scientist who's been the top government advisor on the SAGE committee, Neil Ferguson, who's resigned from that role after he said he made an error of judgment in breaching the lockdown rules, inviting his married lover to his home on at least a couple of occasions when he was supposed to be under the lockdown. What do you make of his decision to resign?
Well, I'm not going to get into somebody's private life, and
he's got into our private lives. He's told us who we can and can't see.
Well, I respect the decision he's made, but I mean, I would make a broader point. This lockdown is vital to suppress the spread of this virus, and obviously, everybody should be following the lockdown rules. And we appreciate that for many people, the lockdown is very, very difficult. I mean, it's fine if you've got a nice house with a big garden, but there's lots of people trapped in small, damp flats, often overcrowded, or perhaps trapped with an abusive partner. And one of my big concerns is that while, yes, I accept the lockdown is needed and supported, I also want to see more support put in place for those who will be detrimentally impacted by this lockdown.
What about the people saying that this is a man who was advising the government, saying we'd lose 500,000 people to coronavirus if we didn't go into this very strict lockdown, and that it appears he didn't himself believe in the necessity of the lockdown? Does that not raise any questions for you about government policy?
Well, I mean, we've been questioning government policy throughout this, and excuse me, I seem to have just got a croaky voice all of a sudden.
That's okay.
I don't think that's because I don't know why that is. Anyway, look, we've been questioning government policy throughout all of this, and we've always been asking whether the decisions that are being taken are based on the scientific advice, and that's why we often call for the scientific advice to be published. I mean, some have asked if we went into lockdown too slowly. Others have asked why we allowed, flights to land and we didn't ask people to quarantine. But particularly as yesterday, the scientific advisors said that we believe in early March, we imported lots of cases from Spain and Italy. Well, also in early March, we allowed, for example, the Atletico Madrid-Liverpool game to go ahead, even though people were questioning whether it should go ahead. So I think it's right, we always question the science or question ministers as to whether they're basing their decisions on the science, but the best way we can reassure ourselves is for all the scientific advice to be continually published.
Okay, well, let's talk about what you've published today, and that's your call for a COVID-19 health inequalities strategy, in particular to protect deprived and black and ethnic minority communities and tackle what you call the hidden health effects of the pandemic. Tell us, what do you mean by that?
Well, I mean, what we know is that if you're from a more deprived area, you're more likely to suffer from and indeed die from various cancers, from heart disease, from respiratory diseases, and this is in every age group. And I think what COVID-19 is doing is we are seeing more and more deaths from deprived areas. We're seeing a higher proportion of people from black, Asian, minority, ethnic communities getting COVID-19 and indeed dying from COVID-19. So I think we need to understand why this is happening and what extra support can be put in place to support these vulnerable, deprived communities who are very much at risk. And then, in turn, while the NHS is tackling COVID, and we understand why it is focused on COVID, it's had to delay a lot of other treatments. Operations have been cancelled, cancer treatments delayed. As the NHS begins to reset, we need to make sure it's got the resources to tackle this huge growing wave of unmet clinical need as well, which will also often detrimentally impacts the worst off in society.
Look, I think everyone is concerned about any death, whoever it is, whether it's someone living in a mansion who's white or someone living in a council flat who's black. And there seems to be so much focus from the left on the black and ethnic minority people who have died and those in deprived areas. And I think a lot of us are a bit confused by this because, again, every single life matters. We know the reasons why people living in deprived areas are more likely to get the virus and die. We know deprived areas tend to be in cities. We know that cities, urban areas, particularly in London, is where the virus spreads. We know that people who are poorer tend to live in deprived areas in big cities. We also know they tend to have worse health, tend to have obesity, to smoke, to drink more, and that leads them to have the health problems, the underlying problems, which leads to them more likely to die. And we know particularly also, even looking at the stats for black and ethnic minorities, they're very different for different ethnic groups. In particular, is Afro-Caribbean people have a much higher rate of death than, say, African origin or white people. And we also know they have a much, much higher rate of obesity and diabetes, the specific underlying health problem that does actually contribute to morbidity from COVID-19. This is all being dressed up as some sort of social problem, as some sort of almost racism or classist problem, when this is just about the medical facts. Healthy people have got a better chance of living from getting coronavirus than unhealthy people.
Yes, but I disagree with you though, is that why are some people healthy and why are some people unhealthy? Well, often I would argue that poverty and deprivation and inequality drives ill health as well, because we know that the poorer you are, the more likely you are to die earlier in life. You're more likely to get illness earlier.
But you're more likely to eat badly, not necessarily not be able to afford to eat well. You're more likely to live on takeaways, be overweight, to smoke, to drink. But a lot of these are people's choices. Now, it might be easier to make better choices for some people than others. I accept that, absolutely. But nevertheless, people do make free choices in a free country, and this is the outcome. But we've known for decades that people who make poor choices like this will likely live a less long life.
But it's the means then with which you have to live which determine the choices you are able to make. And it's a bit like saying everyone's free to walk into the Ritz Hotel. Well, everyone is free to walk into the Ritz Hotel, but not everyone can afford to go and book a room in the Ritz Hotel, can they?
No.
So I mean, and what before the COVID crisis sort of kicked off, as it were, we had a big report from an academic called Sir Michael Marmot who had studied this, and it showed that life expectancy has actually now begun to go backwards for the 20% poorest women in society. So this is the context in which this is going on, and I think you now see it. So not only are you seeing more deaths for poorer people, you're now on top of that seeing a greater number of COVID deaths amongst poorer people. And I think I don't think we can walk on by on the other side. I think we need to do something about it if we can.
Okay, well, telling people you're not allowed to get fat will be probably the best advice you give. Why is everyone so concerned about particular groups who are dying of COVID-19 but seem to be completely ignoring the fact that it's largely men? It seems when there's talk about even taking, say, ethnic minority health workers away from the front line, I haven't heard anyone say we should get men away from the front line. They're more likely to die. Why does no one care about men anymore?
Well, I care about men. I care about everyone. But you're right. I mean, it's often men who are more likely to die from heart disease and respiratory disease. Often in, when particularly in poorer backgrounds, usually a reflection of the type of work that they have been involved in particularly older men. Often a reflection of the manual labour that they did in their work. So yeah, I think these things need to all be looked at carefully and considered. So I think I'm making the point. There is obviously biological factors that we have to take into account, but there's also social factors as well, and that's why I think the government needs to review all this properly. But I think it is self-evident that people in poorer areas, in high-density urban areas, living in overcrowded flats, damp flats, they need better support because this virus has exposed the fault lines in society.
Okay, let's finally also talk about the fellow Labour MP, Rosina Allenkhan. She's not only an MP, she's also a doctor who's returned to the front line, and she asked a question of Matt Hancock, the Health Secretary, your opposite number, in the Commons yesterday. He criticised her for her tone and suggested she would be better off adopting the tone that you have had. She has hit back, saying that she'll use whatever tone, frankly, she darn well wants. What do you make of their exchange?
I mean, I think the irony is the politician who got the tone wrong yesterday was actually Matt Hancock. I mean, Rosanna is a politician, but she's also on the front line as an A&E doctor, putting herself at risk to care for patients. So we should be thanking her for everything she's doing in the NHS.